Okay, so this is the heart. This blue thing here are the veins, and when you cut open the veins, you get the artery. This things here are exactly the same as the schematics in the board. So if you just learn that, you'll be able to locate that very easily. Okay, so inferior vena cava is below the heart. So if you lift open the heart, it's hard to see inferior vena cava because it's internal, but if I would point anywhere below the heart, just write inferior vena cava. Superior vena cava is above the heart, this one.
So it's cut?
Yes, it's cut in all the caps to expose the arteries. So so it's actually continuous like this. It's continuous, right? So they have cut open the superior vena cava and the brachiocephalic artery. So now this is the superior vena cava and this is the brachiocephalic vein. So the brachiocephalic vein divides into two parts, right? So this is the cat's right. So although it's your left, that's the cat's right. So you would always write this side is the right side and this side is the left side, your opposite, but the cat's original position. So the brachiocephalic vein branches off into two sides. Each side, again, it branches into two things, right? So one is called the external jugular, left external jugular vein that goes to the neck, and the left subclavian vein that goes to the arm. So whenever you write the veins, writing right and left is mandatory. I can't write right and left, but it's easy. So left external jugular vein goes to the neck, and left brachiocephalic artery, subclavian artery goes to your arms. Okay. Now you cut these veins to expose your artery. As I told you before, the artery that comes out of the heart is called aorta. Now the aorta divides again. So if I would mark close to the heart here, it's aorta, but if I would mark close to the V here, it's brachiocephalic artery. So the brachiocephalic artery branches off. So one, if you look at the board, so one here is the left subclavian artery, right? And here it branches off into 1, 2, and 3. So this one here is the left common carotid artery, right common carotid artery, left subclavian artery. It's exactly the same as it's drawn on the board. Yes, from the beginning.
No, just the artery. Like
you know
the
what?
Right
and
common, the
one of you try. Has the right. Can you guys come here because I have to give them the heart back. Okay, sorry about that. Okay, so for the heart, distinguishing right and left is very crucial because you have to say right atria, right ventricle, or whatever. So the only way you can distinguish between the right side of the heart and the left side of the heart is by the ventricle. So the lower part is the ventricle, and the upper part are called the atria. So it's a four-chambered, right? 2 are atria and 2 are ventricles. So the left side of the heart, the ventricle, the wall is very thick. And compared to that, if you look at the right side, the wall is very thin. So you can only distinguish by looking at the walls. Plus the chamber is a little bit bigger than the right side. But write it down, ventricular wall is very thick.
On the left or the
On the left. Okay.
Wait, is ventricular left?
Yes. Ventricular walls on the left is very thick.
There's like one on the right.
Yeah.
Yeah.
The reason why the ventricular wall on the left is very thick is because it sends oxygenated blood to the whole body. So it has to pump vigorously. That's why it's more thick.
So
Whereas the ventricle of the right side, has to send blood only to the heart. So it's just unidirectional.
So the ventricular wall on the right is thinner. On the right.
On the left.
No, the left is thicker.
Yeah.
Oh, I said thinner.
Oh,
The
sorry.
ventricular wall.
Sorry.
Yeah, the ventricular wall on the
Sorry.
right is thin. Yeah.
Yes.
It's
Yes.
thin.
Thin.
Right
Thin.
is thin.
I said thin.
Left is thick.
Like a
Okay.
stock of salad.
So the top part here is the atria. Can one of you hold it open for me? You don't have gloves, right? Oh, the smell.
I don't smell anything. Neither do I.
Okay.
Some of the hearts are in like some solution and it looks so gross. So if you lift the heart, it constantly droops down. I hate those hearts.
Alright.
Those are tiny. For baby hands.
Oh, where are the large ones? There are large ones
Too
too.
late now.
Okay. So can you just like
Hold it like open like
yes,
this.
yes. Pull it.
I can pull it more. I don't
yeah,
want to break it.
Yeah, okay. Although I don't know how I will label in the test because no one will hold it open for me, so I'll try. Okay, so anything on the top is the auricle. Anything on the bottom is the ventricle. So this is the left side, right? So left auricle, left ventricle. But because there are other structures here on the ventricle, if I would want you to write left ventricle, I would mark on the wall. So left ventricle will be marked on the wall. This one here that separates the auricle from the ventricle is called bicuspid or atrioventricular valve. Bi means two and cuspid means like cusps means pocket-like structure. So those pocket-like structures separates auricle or atria from the ventricle. Now this cord-like structures here, there are many in number, although here you can only see two, but it's throughout. So these cord-like structures are called Chordae Tendineae. And these cord-like structures are attached to the muscles in the ventricle. So anywhere if I would mark on the ventricle and on the muscle, it's papillary muscle. So just don't get confused. If I want you to write left ventricle, I'll always mark it here. But if I would mark it, write it papillary muscles. So again, I'm saying right auricle, left auricle, left ventricle, bicuspid valve. You can also write atrioventricular valve. I'll give you a mark for that. Chordae Tendineae, papillary muscles. That's it. Now the right side here. So right side is smaller than the left side. For the right side here on the top is the right atria. On the bottom, right ventricle. There are the same structures like Chordae Tendineae and papillary muscles on the right side as well. But if I want you to write those two structures, I'll always point it on the left side because it's more prominent there. Okay, there's another valve here in between the right atria and right ventricle, but I'm not going to test you on that. That is called the tricuspid valve, but I'm not testing you on that. Okay. In this heart, this part is missing here, but it's actually a flap-like structure here. So it's kind of, there's a flap here. It's missing in this one. So that flap is called the semilunar pulmonary valve, or the pulmonary semilunar valve. And this leads to the pulmonary artery here. It's always cut. So if I would mark it here, it's pulmonary artery. It's always cut. Remember, because there is another opening that is big and that is important. So if I would mark here, which is like a big hole here, that is aorta. And if I would mark it here, that's always cut, and that leads to, so if you insert, it leads to your right side. That's pulmonary artery. And then you have the superior and inferior vena cava. So on the back side, I generally do not give it in the test, but even here I can't see it. But the superior inferior vena cava, like if you I think this is the one, but it's cut here. So this one on the top is superior vena cava and on the bottom is inferior vena cava, but I probably won't be testing you on those two structures.
And what's the one that comes out there?
Pulmonary artery. Here? Pulmonary.
No.
The
Yeah.
cup.
The cut one that in the first one that
Pulmonary
you showed.
artery.
Oh, that's pulmonary.
Yeah. Okay, so want to revise?